long way, especially to someone who might be facing the most difficult times in their lives. For some, curing their Hep C is the first step in declaring agency over their own healthcare decisions, as well as their entire lives. By providing this support, it creates a safe space and a greater chance for a successful treatment. In order to continue this great work, we will need to call on our state partners for increased funding. We need this funding not only to provide individuals with ongoing access to Hep C care and treatment, but to invest in community resources and harm reduction programs that help save lives. These programs can include, as I said before, peer resources, patient navigation programs, syringe service programs, and many more. In addition to curing folks who are already living with the virus, it's extremely crucial for us to invest in not only curing, but preventing the transmission of hepatitis C before it even occurs. This will allow us to move closer to our goal of eradicating the virus statewide by 2030, as Jose said. Focusing on a preventative healthcare model to stop the spread of Hep C will result in a healthier New York and will likely lower incidence of liver cancer and other liver-related illnesses. At Whitney Young, we worked alongside community partners in the Capital Region who provided clean syringes and injection supplies to our patients, many of our patients, at no cost. Those were life-saving. Those were life-saving for many of our patients. They were crucial in encouraging safe use and halting the spread of infectious diseases, hepatitis C, HIV, you name it, as well as drastically lowering reinfection rates among individuals who had been successfully cured of Hep C in the past. These programs employ peer navigators and case managers, as I spoke about before, several with their own lived experience, who are able to provide direct care to people at risk of Hep C contraction. This ranges from appointment transportation, care coordination, accompanying people to appointments, you name it. These are greatly successful programs that we have right here in our Capital Region, and we need to have more of them. If we continue to fund necessary harm reduction programs, I truly believe that we can eradicate this virus by 2030, but like Jose said, we have a lot of work to do. This includes not only in metropolitan cities, but also in rural areas in the state where the need for infectious disease prevention and healthcare resources are currently so lacking. And I'm just gonna say this, in the current political climate, it is so much more important than ever that New York State shows up for its community members. Funding Hep C treatment and prevention is one step we can take towards a happier, healthier, and safer New York. And that's that.
Hi everyone, I'm Assembly Member Linda Rosenthal. I represent the Upper West Side, parts of Hell's Kitchen in Manhattan. I'm chair of the Housing Committee, and I've been working in coalition with so many of you for years, trying to eliminate Hep C, fight Hep C spread, HIV, overdose prevention centers, the whole thing. We've all been working in community together. And I'd like to thank Housing Works and the entire New York State Hep C Elimination Coalition for coming here to Albany, for being here while others are stuck on the train. You got here. And so we've made many strides in recent years. We've seen infection rates drop, but even a few thousand new infections are new infections that should not have occurred. And without proper testing and treatment services, these infections often turn chronic, further damaging a person's health. And Hep C is not like others. Often asymptomatic, people go for years or decades carrying the disease without even knowing. And by the time they realize it, it's often too late, and they might have severe liver damage or other health conditions. But we know what works. Unlike other diseases, we have a cure. And not an onerous cure. You heard before, taking your medications for a month can eliminate the virus from your body. We have seen across the state that syringe exchange programs and overdose prevention centers in New York City can help those who might be impacted by Hep C. But now is not the time, as Jose said, now is not the time to take the foot off the gas. By 2030, we have a mission. We can accomplish that mission. Eradicate Hep C by 2030, and every year I lead a letter calling for additional funding for Hep C treatment and prevention, and this year we're calling for $10 million in our state budget. And we know the proven tools to reduce infections But other parts, aside from New York City and the big cities, there are other areas that have been neglected. Places that don't have syringe exchange programs. Places that don't have this robust team of volunteers. Places that don't have champions. And so we need more funding, a greater investment in programs. And we must start pushing those services out into the more rural areas of the state because those communities must not be left behind. So we've had the flat funding of $5 million, but it's not enough to reach our goal by 2030. So we're soon going to begin negotiations over our $260 billion state budget. Finding an additional $5 million to invest in Hep C prevention and treatment will save lives. That's the goal, saving lives. And it can be done immediately. I mean, there are very few things that will have immediate impact and such a positive impact by saving people's lives and sparing them suffering and letting them go and live a normal life. That's what this is all about. So we will eliminate Hep C as a public health problem in New York State. It's well within reach. And when you hear in the federal government, like, you don't need a vaccine for anything, you can choose whether to have a vaccine when we know vaccines work. Don't let that pollute the Hep C world where we know we can cure this virus. We can save lives. We can make people go on to live the way they want to without being crippled by an illness that really severely is painful and can be deadly. So thank you all for being here again, and I look forward to
Just really quick, thank you to Assemblymember Roosevelt for your continued champion of this effort, and we really appreciate you. So on behalf of everyone here today, all New Yorkers, and everyone at Housing Works, thank you. And I'd like to bring on our next speaker.
I am a community health worker, patient navigator, and peer advocate for the Coalition on Positive Health Empowerment. We do HIV testing and also linkage to care. Our new focus is on developing having workshops, that focus on the chronic diseases that affect our community, because we feel that education has the greatest impact on people having knowledge of the disease or the diseases that are affecting us. I wrote a rather extensive speech, but I'm going to limit it to just the final points, right? As I said, I'm Divine Prince of Love, and I want to thank you for the opportunity to speak on an issue where New York has been a national leader and where decisions you make today will determine whether we finish the job, that is eliminating hepatitis C as a public health threat in our state. In 2018, New York made a historic commitment to eliminate hepatitis C by 2030 by launching a comprehensive elimination plan centered on prevention, testing, treatment, surveillance, and strong community partnership. That plan recognized something profound. We cannot end Hep C without the full participation, leadership, and trust of the communities most affected. Today, the Coalition of Positive Health Empowerment, along with the community health agencies and advocacy organizations that have gathered here, stand firmly in support of this elimination vision. Yet, we are also sounding an alarm because we know that without sustained funding, stronger harm reduction support, and a deeper commitment to equity, the promise of elimination will not reach the New Yorkers who need it most. Where we stand now, over the course of the past several years, New York has built a serious infrastructure to fight hepatitis C. The state convened a hepatitis C elimination task force, created detailed elimination targets, and developed mechanisms to track progress through tools like hepatitis C elimination dashboard. New York City has its own plan to eliminate viral hepatitis as a major public health threat by 2030, with clear goals to reduce infections, reduce premature death, and reduce health inequities and disparities in care. These efforts have produced gains, more testing, more people treated with curative medications, and greater coordination between government and community partners. Community coalitions such as the New York State Hepatitis C Elimination Coalition, HEP C New York City, and regional framework across the state have been central to this progress, helping design strategies, run outreach programs, and keep marginalized populations at the center of housing. Yet progress is not the same as victory. The very dashboard and reports we use to measure success also shows us the disparities persist, especially for people who use drugs, people who are incarcerated or recently released, people who are homeless or unstably housed, and especially disenfranchised Black, Latinx, and immigrant communities across New York. In closing, community healthcare agencies and advocacy groups are ready, as can be evidenced by those who are here today. We have built coalitions, designed innovative models of care, and brought our lived experience with policy spaces, within policy spaces. We believe and know that elimination is possible. And we are asking you, the legislators, and as candidates for re-election, to fully join with us. Today on February 3rd, 2026, you have the power to make hepatitis C elimination not just a plan on paper, but a reality in every neighborhood, every jail, every clinic, every community across New York. Speaking for us all, and we ask that you choose to be the legislature that finished what we started. Let us all choose to be the generation that ended hepatitis C in New York State. Thank you.
All right, so our final speaker is someone who is incredible advocate and change maker. I want to introduce Colleen Flanagan. Thank you.
Hi, good morning. Thank you so much. Thank you, Ellie and Housing Works and everyone else who is here today for your continued support. As Ellie said, my name is Colleen Flanagan. I am the director of the Office of Hepatitis Healthcare and Epidemiology at the AIDS Institute at the New York State Department of Health. I'm joined here today by a bunch of my colleagues. Thank you so much for also supporting this day. Our director, Joe Kerwin, some team members from the office who are here as well. It's good to see so many people here. I feel like every year we grow in number, so thank you so much. So we recently released our surveillance report, our 2024 surveillance report, and as some have said, we have seen a decrease in the number of new diagnoses of hepatitis C since last year, which is a good thing. However, our numbers do remain high, especially in individuals under the age of 40, so those younger individuals, with, again, the main driver of these new infections is injection dampers. So we heard a lot about this morning from other presenters about harm reduction, about syringe exchange programs. Those interventions are Hep C prevention interventions. So you heard Mary talk about high rates of hepatitis C in rural New York State, and so some of us got in our car this fall, drove across New York State to some rural counties, held some focus groups with individuals living in those rural areas doing work related to hepatitis C. And what did we hear about? We heard about lack of transportation, we heard about lack of housing, we also heard about limited harm reduction services. There was literally one organization who had one individual wearing a backpack who would go out and do syringe exchange on the street. We also heard about limited capacity within primary care programs like community health centers. Stigma is a huge barrier, and I think everyone here can agree that stigma does limit individuals' ability to access health care. So what are we doing about that? So we recently released a funding announcement where we will fund telehealth and telementoring.
to build capacity within these rural areas of New York State, but also to provide telehealth services in settings where they don't currently have a hepatitis C provider. So that includes drug treatment programs, harm reduction programs, shelters. And so those particular contracts will be executed later this year. So one exciting thing that I wanted to mention, if you were here last year, you may have heard me talk about the newly approved point of care hepatitis C diagnostic test, right? This is a finger stick test. So you stick someone's finger, and within about 45 minutes, you can give a diagnosis of hepatitis C and either immediately start hepatitis C treatment at that point in time or make that referral to healthcare. This is really a game changer for us as we have seen Hep C screening evolve over time in New York State. And I'm happy to say, using funding from the state executive budget, we were able to provide funding to all 12 drug user health hubs to implement the new point of care diagnostic testing. There's also going to be this test available in primary care sites, in opioid treatment programs as well. So we heard about stigma. We know that stigma should not prevent individuals from being cured of Hep C. And so what we've been able to do is fund programs, support programs to co-locate Hep C treatment in settings where people who use drugs feel most comfortable. So we currently fund 3 of those programs. We have over 95% cure rate. These are individuals who are actively using drugs. Some people don't think we can treat individuals who are actively using. We can, and we can cure. And so again, using additional funding that we received in the state budget over the last 2 years, we will be able to fund more than 3 programs beginning this next summer. So we are super excited about that. So one other thing, last year we implemented the New York State hepatitis C testing law for universal screening. New York is one of the few states that actually has a universal testing law. Also universal screening of all pregnant people during each pregnancy. And as a result of that new pregnancy testing requirement, we have established a perinatal Hep C prevention program, building off of our very successful HIV perinatal prevention program. So we are really excited to identify individuals, pregnant people who need treatment once they deliver their infant, and infants who may have been exposed to Hep C so that they can be tested and treated at the appropriate intervals. So our goal is to eliminate Hep C by 2030. We heard that a lot today. We are committed to that. And I think because of each of you here today, you are also committed to that goal. If you want to track our progress, please go to hdb-ny.org to track our progress. While we continue to exceed our elimination metric in getting people diagnosed and also preventing new infection, we still fall below our treatment goal of 80%. We are around 55% right now. We need to do better there. So therefore, this work must continue. We must all remain committed, and we must all work together to eliminate Hep C in New York State. So thank you so much for coming today.
Thank you all for being here.
Oh, thank you.
This concludes our rally, so we really appreciate you all. We will see some of you in meetings today. We will see some of you at a future date, but thank you again for being here.
What is the stigma?
What is the stigma?
Yeah, to teach English because that's a difficult word.
It's not a typical word. Stigma is like discrimination. So people feel bad or are made to feel bad about some sort of behavior or action. And therefore they become isolated, they don't access services. So it's definitely a negative in terms of getting people treated and cured.
Thank you. Thank you.